ready to dive deep into the world of ultrasound-guided vascular
Oh,
access.
yeah. Always up for exploring how this tech is changing the game.
Well, we've got a fascinating journey ahead, fueled by the insights of two emergency medicine gurus, Dr. Avijit Barai and Dr. Conor Kelly, those EM superstars.
Right, right. I've been following their work. What did they have to say?
Well, one of the things that really struck me was how it wasn't that long ago that ultrasound was, kind of a last resort, only for the really tough cases. You know what I mean?
Yeah, totally. Like the old landmark techniques were still the go-to back then.
Exactly, but now it's like flipped completely. Dr. Kelly was saying he uses it for almost every single access now.
Wow, that's a huge shift.
Right. Talk about a 180-degree turn in what, like 10, 15 years?
Makes you realize how much more efficient ultrasound is.
Absolutely. And, we're all about respecting your time, right?
Efficiency is key, especially in emergency medicine. Every second counts.
Exactly. Plus, think about it from the patient's perspective. Who wants to be poked multiple times trying to find a vein?
Oh, absolutely no one. I mean, less pain, less anxiety, fewer complications. Sign me up.
Right. It's a no-brainer. So how does this actually work in practice? What are we looking at here?
Well, the podcast really dug into two main techniques, in plane and out of plane.
Okay, break that down for me.
So imagine you're trying to thread a needle, right? If you're looking at it from the side, that's in plane. But if you're looking down at the needle going in, that's out of plane.
Okay, I think I'm getting it.
And for most IVs, that out of plane technique, like you're looking down at it, that tends to be the go-to.
Ah, like a bird's eye view.
Exactly. It's like having that roadmap right there on the screen.
Makes sense. But I noticed that regardless of the technique, both Dr. Barai and Dr. Kelly really emphasize that you should never lose sight of that needle tip.
Oh, absolutely. That's crucial.
I mean, is that really such a big deal?
Oh, huge. Dr. Barai actually told this story about a colleague who was having trouble getting blood from a patient, so they decided to use ultrasound, and get this, the catheter had gone straight through the vein and out the other side.
Oh, wow. I did not need to visualize that today.
Right. Goes to show you how ultrasound can really reveal those hidden problems that you might miss otherwise.
It's like having X-ray vision for veins.
I know, right? And the experts emphasized it's not just a static picture. You got to be adaptable, making those micro adjustments with the probe, accounting for patient movement, sometimes even switching between techniques to get that perfect view.
So it's a bit like trying to hit a moving target.
Yeah, in a way. You need real precision and adaptability.
This is really changing the game, isn't it? And it's more than just fancy tech for doctors, right?
You got it. It's interesting you say that because there's a big push now to train senior nurses to use ultrasound for access.
Now, that makes a ton of sense, doesn't it?
Oh, totally. Take some pressure off physicians. Patients might get care even faster. Win-win all around.
Absolutely. And, it's not just about convenience either. Dr. Barai talked about this patient. Over 260 pounds, traditional IV access, no way. Right. But with ultrasound, boom, needle goes right where it needs to. That just blew my mind.
Shows you what's possible, right? Sometimes it feels like magic, but it's just really good tech.
Totally. And it seems like everyone's catching on.
Oh, yeah, for sure. I mean, formal guidelines are a bit slower. They're always playing catch up. But everyone agrees ultrasound guidance, it's becoming the standard of care, no question.
Well, yeah, I mean, you think about the patient, right? Less pain, way less anxiety, that's huge.
It's enormous. Dr. Kelly even said it could help reduce PTSD, for people who've had really rough experiences with IVs.
Oh, wow. Yeah, that makes you think about the whole human side of it.
Right. And he highlighted they're using more topical anesthetics too, like Emla cream, trying to make the whole experience less painful. It's like a whole different approach to care.
Instead of just going for the vein, it's about the whole person.
Exactly. And he used this phrase, moral injury, for healthcare providers who have to keep doing these tough procedures on patients when they know there might be a better way.
Yeah, it's true. We talk about the patient's experience, but the providers feel it too.
For sure. So looking ahead, we've got all these amazing new devices, AI on the horizon, but we can't forget that human element, that empathy, that makes all the difference.
Totally. And speaking of the human element, Dr. Kelly had this really cool insight about vein selection. He was saying how the cephalic vein, often overlooked, is actually ideal for long-term access because of where it sits in the arm.
Interesting.
Right. It's not just about the tech, it's about knowledge and experience too.
Right. Absolutely. It all comes together. At the end of the day, to really master this, it takes practice, dedication, always learning. But the payoff for everyone, it's huge.
Couldn't agree more. So if you're listening and feeling inspired, remember, Ultrasound-Guided Vascular Access. It's not just about a cool tool. It's about more human, more compassionate care. That's the takeaway.
Couldn't have said it better myself. Using what we've got to make healthcare a little less stressful, a lot more human.
Now there's something to think about. Until next time, keep exploring, keep asking those tough questions, and we'll catch you on the next deep dive.